Hey guys, come along with me today to do a full treatment on this patient. We are treating her frontalis first, so as you can see, I marked those lateral borders of the frontalis. I'm always making sure I'm one finger breadth above that brow. On the other side, I'm also marking that lateral border of the frontalis. I typically like to have my patient clench their teeth so I can fully assess how far that frontalis is and to ensure that I am injecting all the way over on that frontalis in order to prevent a spocked brow. The next muscle we are treating is the glabella complex. This is a 5 muscle complex, so you have your procerus, your medial and lateral corrugators on each side, and then I marked up for a brow lift on each side. Very important when you're treating for a brow lift that you're not treating all the way lateral on that frontalis, so you do get a little bit of that brow lift. I'm also treating crow's feet, so I'm having my patient smile really big, and I'm also doing a little bit of jelly roll tox. So as you can see, I made a mark in that soft tissue underneath the under eye. Here I am injecting the frontalis muscle. As you can see, I'm about half needle depth. I am making sure that I'm going at a 45-degree angle, positioning myself in any way that is comfortable to me. And I'm always having my patient express and relax during the treatment so I can confirm my injection sites. I always mark up still to this day just so I'm confident in that. I can chat with my patients and I really don't have to focus in on that. But overall, the area should raise a little bit and you should get full coverage from one lateral border to the other lateral border. From there, we are then treating the glabella complex. So we are going 90-degree in, straight in for the procerus, and then we are going a 45-degree angle, true 3/4 needle depth for that medial corrugator, and for that lateral corrugator, we're going a true half needle depth. When you get more lateral, the corrugators get a little bit thinner in that muscle complex, so you have to be aware of the frontalis. The frontalis lays under that lateral corrugator, and as that lateral corrugator gets thinner, you want to adjust your depth to a half needle depth so you don't inject too deep and hit the frontalis. Here I am now injecting the crow's feet or the orbicularis oculi. As you can see, I mark those injection sites by having my patient smile really big, and now I'm injecting up and away from the eye. I always like to make sure that I'm over that orbital rim. This injection right here, though, is in that soft tissue that is called a jelly roll. What that is doing is it's preventing the muscle from creasing there underneath the under eye when your patient smiles and animates. So all of these injections should be relatively superficial, and always make sure that you're protecting your patient's eyes. Here I am injecting that jelly roll. Like I said before, very, very superficial. That product should go right in there and bleb. From there, we are doing a brow lift. As you can see, I'm going parallel with that brow. I typically have my patient close their eyes as tight as possible to really confirm where I'm going with this injection. You want to be at that medial and lateral portion of that brow to really give it a raised look. You also want to keep in mind that when you treated the frontalis, you didn't treat all the way over to that lateral border fully because you don't want to counteract the brow lift that you are about to do. Next, we are doing the LLSAN that is responsible for gummy smile reduction. So we're doing a small dose here